stroke occurs when the blood supply to part of the brain is interrupted or reduced. This prevents nutrients and oxygen reaching the brain, and the brain cells die. 1 in 4 of us will get a stroke during our lifetime. It's one of the most common conditions in the world and in the UAE. It's very important we learn to recognize signs of stroke and how to react quickly. It's even more important to know how to prevent a stroke and manage the risk factors. The World Stroke Day is observed annually on the 29th of October. This gives us an opportunity to increase the awareness of stroke, what to do during the stroke, and how to prevent strokes. This way, we reduce the impact of stroke.
A stroke requires immediate medical attention. Blood not reaching brain cells will lead to the cells to die. For this reason, when the patients arrive to the hospital, neurologists, emergency doctors, as well as neurointervention radiologists, all of them will try to remove this clot in a procedure that will not last more than 30 minutes. The clot will be removed and blood will reach the brain. For this reason, the time is crucial and you should act fast. The needed time to remove, it's only 30 minutes, but it can be done only for those patients that arrive before 6 hours. So you should act fast and not wait.
There are many risk factors for stroke, but here we are focusing on the risk factors that can be managed. For example, obesity or overweight, physical inactivity, high blood pressure, diabetes, cardiovascular diseases, high cholesterol, or smoking. So now, since we know the risk factors, what we can do in order to prevent stroke? First thing is knowing your risk factors. As every individual has different risk factors, so by knowing the risk factors, then we know how to prevent them. Secondly is by following healthy lifestyle, which is focusing on healthy diet, which has less saturated fat and more vegetables and fruits. In addition to that, exercising regularly, and also, like, if you are a smoker, to quit smoking. If not, to prevent being a second-hand smoker by not sitting with the smokers or being in an area where there people are smoking. Lastly is following your physician's or doctor instructions when it comes to medications and follow-up. Here we are talking mostly about the patients who are having high blood pressure, diabetes, cardiovascular diseases, or high cholesterol. So not to stop medication when you feel better or when the symptoms resolve, but you need to consult your physician and follow as the doctor ordered. In addition to that, the follow-ups also. So by doing all of those, hopefully the risk of the stroke will be dramatically decreased.
If you or someone you are with is having stroke, pay particular attention to the time the symptoms began. Watch out for trouble speaking and understanding what others are saying, paralysis or numbness of the face, arm or leg, problem seeing in one eye or both eyes, trouble walking. Seek immediate medical attention if you notice any symptoms or signs of a stroke, even if they come, go, or disappear completely. Be fast. Ask the person to stand still or walk in a straight line. Do they find it difficult? Ask the person about their vision. Have they lost sight in one or both eyes? Ask the person to smile. Does one side of the face drop? Ask the person to raise both arms. Does one arm drift downwards? Ask the person to repeat a simple phrase. Is their speech slurred? If you observe any of these signs or symptoms, call for emergency medical attention immediately.
السلام عليكم، أنا الدكتور محمد الكويتي، استشاري الأعصاب في مستشفى توام. اليوم بكلمكم ماذا تفعل إذا أصيب شخص بسكتة دماغية. أولاً، بادر بالاتصال للحصول على المساعدة الطبية الطارئة على الفور. لا تنتظر لترى ما إذا كانت الأعراض تتحسن. كل دقيقة أثناء السكتة الدماغية مهمة. كلما طالت مدة السكتة الدماغية دون علاج، زادت احتمالية تلف المخ والإصابة بالإعاقة. ولا تنسى أن تكون سريعاً في التعامل.